Good morning, everybody. And today's drug is going to be Flumazenil. And we're going to talk about how to kill a good time. So that's what we're going to talk about. With that being said, let's go to what we use it for. It's better known as Romazicon. You need to know Romazicon. Make sure that you know that. And it's used to reverse benzodiazepines. And so if they've taken anything, a Valium, a Versed, any of those types of drugs, anything on this particular list, that means that it will reverse that. And again, this class of drug is a benzodiazepine receptor antagonist. It actually competes for the receptor sites without all the bad side effects for it. Kind of like a Narcan for benzodiazepines. But again, we don't always reverse them, but when we do, we like to use Flumazenil. Now, in EMS, we really need to be careful about when we do that. Again, these are just the actions of it. It does not antagonize other things. Barbiturates, particularly, it does not do that. And a matter of fact, one of the biggest problems when we give Flumazenil is the drugs that we use to stop a seizure, which is, again, your Versed, your Valiums, they won't work if you've already hit them with the Romazicon. And so we have to go to our barbiturates such as phenobarbital in order to stop a seizure. Really complicates things for EMS, and that's why a lot of the medical directors don't like to give you that option. When it onsets, it usually takes 1 to 2 minutes to work, a short onset time, and the duration of the action is usually less than a benzo. So if you give a dose of Romazicon, you get it to reverse, you might have to give another dose in a few minutes in order to have that drug work and work effectively. You may have to redose them. So again, we use it to reverse drowsiness when it's caused by a benzodiazepine. I can't stress this enough. You cannot use this drug unless you know for a fact it was a benzo that the person took. And we'll talk about that here when we get to the contraindications of it. Again, one of the bad problems is it can cause seizures, breakthrough seizures. You're taking away their buzz, so all of these things kind of go along with that. It can cause a person to have cardiac arrhythmias. Again, nausea, vomiting, obviously. But again, a lot of pain at the injection site. So when you give this drug really slow. Again, usually we give it over 2 to 3 minutes at a bare minimum. So better is to go even longer. Now, we talked about when not to use it, and the big ones here is if you've got a known seizure patient, you don't want to use this drug. Again, we use benzos to fix that problem in most patients. If they have been given something to control intracranial pressure, status epilepticus, and you give Romazicon, you just took away their cure. Again, if they're taking tricyclic antidepressants, we don't want to give Romazicon, and we just don't give this drug willy-nilly as far as if there's a coma of unknown etiology. We absolutely don't give it. So again, we want to use it in caution with head injuries because, again, most of the time head injury patients, we usually end up sedating with a benzo. If we take away that ability, it's not going to work. Again, it might cause some a long degree of tolerance. Again, you should be used in caution with patients with alcoholism. Again, it can cause an adverse reaction that we don't want. And especially if they mix the drugs, and unfortunately people that like to kill themselves will take a benzo along with maybe their mood enhancers, and that's when we start running into problems. And again, if it's been known to have occurrence of seizures, and especially if they've been on a medicine in order to prevent seizures. So be careful, and you're going to have to use phenobarbital to control the seizures after Flumazenil use. Really limits your ability to do that. So again, they've been known to cause panic attacks. Again, you're taking away their calming effect. So again, and you really want to give this through a big vein, nice and slow, because again, it does hurt. It burns a little bit when they do this. Again, so especially if they've been on long doses of benzos, if they take Xanax on a regular basis, this is not the drug for you probably. Again, they should be monitored for resedation, and we give it, again, very slow, and be prepared to ventilate just in case something does happen that's kind of adverse of effect. It's usually 0.2 milligrams we give over about 15 to 30 seconds. And again, we can redose them with 0.3. We actually go 0.5 on the third dose. And you can continue to dose them, but again, till a total of 3 milligrams has been given. That's a lot of Romazicon. When I have given Romazicon, I've never ever gone above 0.5. And again, not recommended for pre-hospital use for kids. We don't want to use that. We have other options. Again, we want to give it slow IV. I can't stress that enough. Give it slow. And again, a category C pregnancy class, again, it can cause some fetal damage, so we got to be careful. So again, this isn't like a Narcan where we give it and there's not as many side effects. There's just as many side effects, by the way, to Narcan. So if you have a benzo overdose, this is your drug to go to. But you shouldn't be just giving it as part of the quote-unquote coma cocktail. One of the biggest problems we've had in EMS is we give this drug along with Narcan, and now we have zero way to stop a seizure. All right, guys, that was Romazicon, or Flumazenil, as the trade name and the generic name for it. Hope you enjoyed it, and I hope it helps out. Thanks, guys.